According to the World Health Organization, every year, an estimated 21 million girls aged 15 to 19 years old living in developing regions become pregnant, and approximately 12 million of them give birth. At least 777,000 births occur to adolescent girls younger than the age of 15 living in developing countries. In South Africa, 2021, Stats SA reported that there were 34,587 teenage mothers. Among them were 660 babies birthed by mothers aged 10 or younger, and the highest numbers coming from OR Tambo district in Lusikisiki, Eastern Cape. The Department of Social Development, as the custodian of children with a responsibility to care and protect children while ensuring their well-being, is concerned about the high levels of vulnerability, abuse, neglect, and exploitation of children, as these factors contribute to teenage pregnancy. Concerned with these stats, they decided to launch a series of dialogues with stakeholders in communities starting in Lusikisiki. The stakeholders include the Department of Basic Education, the Department of Health, the Department of Justice and Constitutional Development, the South African Police Service, CP organizations, traditional leaders, religious leaders, and municipalities. The focus for this engagement with the district stakeholders was to have a roundtable discussion on what the interventions can be to strengthen and to curb the high levels of teenage pregnancies in these communities.
We gathered at OR Tambo district, specifically in Lusikisiki, INgquza-Hill Municipality, to address issues of teenage pregnancy with stakeholders of the municipality. Because Lusikisiki, it is the hotspot within the OR Tambo district because it has got the highest numbers of children who fell pregnant or children that were impregnated. So the purpose of engaging with stakeholders was to basically to evaluate our services and understand what are the gaps in terms of service provision in preventing as well as managing teenage pregnancies. Because despite, all the interventions that we have in place, we continue to see the high rising numbers of children being impregnated. Therefore, it requires us as the different stakeholders to really ask ourselves, what is it that we are doing right? What is it that we need to do to improve the lives of children?
I-awareness campaigns zethu sincedwa kakhulu ngu-Department of Health, very, very visible ezikolweni in terms of usincedisa kakhulu kwi-awarenesses on HIV, teenage pregnancy awarenesses, and a lot of awarenesses. Andizuzibala zonke. Also, we've got department social development. Uyavata ke kwi-children's rights ezikolweni. Ngo-March uyachila and is assisting us also kwinto ze-grant zabantwana nezi-rape cases. Sense uba we are working well with them. We've got sisebenza again, and they are visible, guys. You go to the logbook yesikolo, you'll see indlela visible ngayo health infected departments. We've got our giant NGOs, MIET. MIET ujongene menstrual hygiene management. Umntana lo umfundisa into yoba eli gazi liphuma ngaphantsi livelaphi, and bafundiswa abantwana, and sijonga grade 4 to 6. Sifuna aba bangaqala umense, and you'll be surprised, they know a lot. Ubabuza uba uthini xa umensa, ayufaka into ngaphantsi. So sibaqala kula age, and then sithi move, xa sesimova up, asibaxeleli kuba kumithwa njani, but we say if eli gazi aliphumanga and wena budibene nenkwenkwe konakele kuwe umithi, sigqithe sithi ngasentla kwi-sexual, reproductive and health rights, sibaxelele into yoba accessani i-health services.
Currently in INgquza-Hill, we have launched Palmerton successfully for February 2017, and it was a huge aspect where we're launching what we call the youth zones. Those are spaces that are meant specifically for young people with a trained, dedicated nurse. But we know that that is not enough. And 8 out of 12 clinics have already been given accreditation for them to roll out that youth zone package within INgquza. I'm being specific now to INgquza-Hill. Same as with the help of our Dreams program from Department of Basic Education, we're able to do all of those in about 40 schools. INgquza team will correct me if I'm wrong. And also those other activities that are led by our partner, TB HIV Care. They are also rolling out a lot of activities around. Okay, then with OR Tambo, because on average, each year, OR Tambo delivers more than 30,000 babies. So you can see that if you look at OR Tambo, now up to December, we are at close to 25,000 babies that were delivered. So if you go to Alfred and Zong, on average, they deliver about 15,000 babies. So you can see that there are 10,000. That is why when you look at the raw number, you say by far OR Tambo is leading. Because now we're talking about the actual babies, the actual girls. So this age, as I have said, I don't like the term that says teenage pregnancy, unfortunately. You have to forgive me. This is not a teenager, by no means. This is a child. It's a 10, 14 years. By the way, the reason why we calculate this was only started for us to measure these numbers from 2017. Because we used to measure, if you still remember, before 2017, about before 18 years. But we saw that this does not give a clear picture. Because in that bracket, we have a 17-year-old, a 16-year-old, and a 12-year-old. That is why we had to desegregate again with a national indicator that I said. And in the discussions that we had, because we're going to change again our district health information systems, we're going to reduce the number to 9. Because we've seen that there are areas where you find a 9-year-old pregnant girl. So we need to make sure that we don't leave it out. So those are actually people that actually literally physically went and gave them. The ones that you can see in the delivery register. I'm not talking about estimates or anything. I mean, not tando, followed by that. So I'm sure you can see. Then when you zoom in now to OR Tambo, you'll find that INgquza-Hill, 21-22, is already at 28%. With 2 hospitals that are here in the area, we have the Holy Cross Hospital and St. Elizabeth. It's really, I didn't want to show that one, but I think I need to share it. If you go to Holy Cross, there are some months where you find that young girls between 10 to 19 years account for about 80% of deliveries that actually take place. Out of 100 young mothers, I promise you, I'm not lying, I can project that. Literally, those from 100 mothers that actually get into the hospital, 80% are young ones. Only 20% that are those that were supposed to fall pregnant physiologically, let alone that others would be married. But remember, physiology and anatomy has nothing to do with marriage and everything to do with the development of that particular child.
Teenage pregnancy stats demonstrate the vulnerability of children and exposure to violence, child abuse, neglect, exploitation due to many factors which often result in the high rate of school dropouts, exposure to adult life, early child marriages, forced marriages. A mere 26 kilometers from Lusikisiki lies a small village of Mboki. Here, we were introduced to a family whose 15-year-old daughter fell pregnant after being raped by a 23-year-old man who also happens to be their neighbor. Upon finding out of this pregnancy, the parents then reached out to the local social worker.
Under 16 years, oye wakwi-relationship nomntu omdala naye. Wafikiswa kwi-offices zethu nge-6 kaJanuwari zii-parents zakhe. Bethi bazoripota kuba bebufumanise umntana ukubana ukhulelwe. ube na 15 years because iqale 2021 ngoJuni. Ngala xesha ube na 15 years but uzofika kodwa sekena 16 uthi udibene nalo bhuti wathi uyamthanda. Ngoko kutsho komntana una 23 years ubhuti lona.
Wabonakala kuba ezinye umntwana njengoba efunde bezoye high school ebeseyile futhi obhalise high school kwathi uthe ngoku indaba yesa high school siyafuna kona uba makaye esikolweni asinandlela yemali ngoba kuthiwa khona no-anti abagcina abantu phaa xa bekhulele asinandlela utata lapha ekhaya asebenzi namandiphangeli asinokwazi uba ngoku makahambe aye high school wona sinawo umdla ngoba kaloku uyalibaziseka nathi asithande kwasesicinga umntu awethu uzoqhubeleka apase kwayena enyakeni. Kwacaba ngoku xa sithethisana nonontlalontle njengoba besesimfunele nesikolo umntwana usemncinci esemncinci nje ufuna ahlale phansi komzali. Isikolo ngoku sile kwenye ilali ekuthiwa kusephambili le ngakomatheko akanokwazi ke ngoku uya phaya itransport ayikho ezomthatha apha ekhaya imselena.
Ndiphathwe kahle kakhulu pha mama, ndiphathwe kakuhle pha kungoba nangoku ndisalindile isivumelwano sethu nabo akwabikho nto izongo. Isivumelwano sethu sithi umntwana funeka mesebelekile umaxa uzoqhuba ikheyisi. Into endiyicelwe ngumcuphi nonontlalo kuzothi umntwana ubaqala abelekwe ube maxa ngekheyisi iqhubayo nalo mntu enze le nto ngoba kukho into efuneka ithathwe emntwaneni nakumenzi. Hayi akabanjwa. Ibindiphatha kakubi kodwa ke ngoku ndiyamkele ngoba ndiyichazelwe isizathu esibanga loo nto. Ndayamkela ke ngoku ngoba ndiyeva uba yintoni ebanga uba ngabanjwa. Hayi ke mama yabo kweyinto ngoba nanko emva kwendlu kaloku. Ewe ndiyonakala kodwa ngoba sendikwenye inkundla ndonakala ndisilungise mna. Hayi kwa ndionakala konakala kodwa ke ndisilungisa mna ngoba sendiyazi uba uthiweni kwinkundla ebendiye kuyo. Okay, phaya ekuqaleni ukuva kwami ngonkosikazi bomntwana onje ayindile. Ndacela kumama apha kundidibanisa nosapho lakhe naye. Ndifuna uba makaqonde le nto ndiyibona apha kwam. Hayi umama into yenzileyo nyhani ke uyikhwebile ifemeli yakhe ngolo suku ndimcele ngalo. Ndafika ke ngoku ele nkwenkwe yona ingekho. Hayi ndalubeka ingxaki endise ngayo. Wathi umama hayi ndiyivile kodwa iyophendulwa ngumnikazi wayo. Ngako mkhulu ayonkosi ndafuna ndamcela uba ndimangale ndifuna undikhwebe lowa mama kukho nto endifuna ukuyiqonda phaa kuye ebesiyithethile ongasayenziyo ngoku. Ayonkosi nyani wakhupha umntu ozapha salini ukusuku saya. Ndafuna ukuqonda kulo mama uba ndehlukana nawe mama ndithe ndicela ukuthetha nonyanakho. Wangabi sandibuyisela mpendulo ngoba uthini kutheni. Wathi lo mama hayi uthe unyanam akayibhilivi le nto ubuye ngayo phaa ekhaya. Kuthiwa ke ngoku siyavuma uthi akayibhilivi awundibuyiseli ngani impendulo yakhe. Hayi ndiye ndaqonda uba mna metsho kanje wena uyobona uba uyabuya noba ubuyi ukuza kwam. Hayi ke makhelwane kulunge bendifuna ukufota. kwaphela ndabe ndizazi uba ndiyaphi mna. Ya, isame lapho ke mama.
According to 2019 and 2020 statistics, provinces with the highest number of pregnancies amongst children are as follows. In KZN, during 2019, there were 671 deliveries by the 10 to 14 years, and in 2020, there were 661 deliveries. The 15 to 19 years were 17,211, and in 2020, they were 17,740. In Gauteng province during 2019, there were 631 deliveries by the 10 to 14 years. And in 2020, there were 934 deliveries. For the 15 to 19 years, there were 15,251 in 2019 and 19,316 in 2020. In Limpopo during 2019, there were 447 deliveries by the 10 to 14 years. And in 2020, there were 512 deliveries. For the 15 to 19 years, there were 18,363 in 2019 and 18,893 in 2020. In Eastern Cape during 2019, there were 671 deliveries by the 10 to 14 years. And in 2020, there were 661 deliveries. For the 15 to 19 years, there were 17,211 in 2019 and 17,740 in 2020. In Mpumalanga during 2019, there were 618 deliveries by the 10 to 14 years, and in 2020, there were 452 deliveries. For the 15 to 19 years, there were 11,786 in 2019 and 13,879 in 2020. For 2022 and 2023, there will be concerted effort in providing information, awareness, and education in the identified high-risk provinces, which are the Eastern Cape, KwaZulu-Natal, Limpopo, and Gauteng. There will be strengthening of provision for prevention and early intervention programs, including programs promoting social behavior change. There will be rigorous programs on education and awareness of the obligations to report in line with the Section 110 of the Children's Act 38 of 2005. Age of consent, including sexual experimentation, capacity building on relation legislation on sexual offences against children. Example, Sexual Offences Act 23 of 1957. Criminal Law, Sexual Offences and Related Matters Amendment Act 32 of 2007. There will be strengthening of intersectoral collaboration with key stakeholders such as the Department of Health, local health centers to ensure smooth referral pathway, proactive referral of reporting, prenatal and postnatal cases to DSD, to ensure proper alignment and coordination of childcare and protection interventions, prevention and early intervention programs, social behavior change, etc. Lastly, the implementation of the integrated school health program, both at provincial and local level, will be intensified to ensure coordinated planning, reporting, and provision of appropriate interventions. Using the District Development Program, the Department of Social Development and its other stakeholders will continue to empower these young mothers, capacitate them, and also possibly link them with parental skills programs, skills development programs, all within their communities.